Yeah, just a quick review of the book, Critical Care Ultrasonography. So basically the book's divided up into 4 sections. I'll go over each briefly just to give you an idea what's in the book, see if it's something you're interested in. Section 1 is general principles and impact of ultrasound use in the ICU. Here goes into stuff like physics of sound, transducers, also covers pediatric critical care. Section 2 is cardiac sonography in the ICU, goes over like TTEs and TEEs. Section 3 is ultrasound evaluation of the neck, trunk, and extremities. And it covers things like ultrasound evaluation of the pleura, the lung, the abdomen, etc. Section 4 is ultrasound guidance for procedures. Covers interesting things like ocular ultrasound, ultrasound guided transthoracic procedures. So yeah, as you can see, this book covers a lot of information. I think so if you're looking for a good textbook on critical care sonography, I think this is a good choice. Now, if you do a lot of scans and you're having any musculoskeletal problems, which is almost an inevitability with sonographers if you're in the field long enough, have a lot of aches and pains like your shoulder, your wrist, or your elbow. It's another resource I want to bring up real quick. It's called Easy Exercises and Quick Fixes for Sonographers with Pain by Jim Johnson PT, written by a physical therapist. Basically, it covers all the most stressed out tissues that a sonographer has. So basically, it's starting with the thumb. It's kind of working its way up the arm. It covers the wrist, the elbow, the shoulder, the neck, and the lumbar spine. So basically, this is a book of exercises and tips that you can do. Exercises take just a minute or two, and you do them a couple times a week, and it can actually fix a lot of problems, pain problems you might be having, or it would actually do a long way in preventing any problems. So just real briefly, this goes over like the thumb. There's a distraction technique. If you have like thumb arthritis or an overworked thumb joint, distraction really feels good. Basically, just takes all the pressure off the joint, gives it time to rest and heal. So it shows you a technique for that. There's a couple muscles, your abductor pollicis longus, your first dorsal interossei, according to the book. These are muscles that support the thumb joint. So if you strengthen these muscles, it'll go a long way in treating any pain you have in that area and keeping you out of trouble. It also shows you a technique to instantly lower carpal tunnel pressure. So carpal tunnel syndrome, the problem is increased pressure in the carpal tunnel. So it gives you a technique that you can do, and do it a couple times a day. It'll keep that pressure down in the carpal tunnel, so you can avoid carpal tunnel syndrome. Wrist distraction, goes over some stretches for your wrist, goes over some strengthening exercises for your wrist. Goes a lot here in the wrist about increasing circulation. After a long day of scanning, you do a lot more scans than you ever thought you'd be doing. Your wrist just gets really sore. So increasing the circulation kind of flushes out the toxins, relaxes the muscles, just kind of feels good. It just kind of resets your wrist. This goes into like contrast therapy, where you alternate hot and cold. Feels really good. Just takes 2 or 3 minutes to do. There's also show you some massage techniques with a tennis ball, but that's kind of cool. Splints, if you're to that point, goes in a little about splints, what to look for. The shoulder goes a lot into rotator cuff strengthening. Basically, if you want to stay out of shoulder pain, your shoulder is a very shallow ball and socket joint, and it relies heavily on muscles to support it and keep that ball firmly in the socket. Rotator cuff is the main group of muscles that does that. So if you do a lot of scans, you hold your arm in a certain position, especially if you abduct it, it goes out to the side, you keep it there, you're going to fatigue your muscles, especially your rotator cuff, and then you're going to get this increased motion in your ball and socket joint. And that's going to create problems like tendonitis, bursitis, etc. So having a strong rotator cuff is paramount if you're going to stay out of trouble with shoulder pain. Goes over scapular stabilization exercise. Got some good stretches for your shoulder. Goes into the neck, has a strengthening exercise. Also been shown to treat neck pain. Strengthens the front neck muscles and is quite effective in decreasing neck pain. A lot of research on anterior neck muscles. If you strengthen those, it gets you out of pain. Has some stretches, and lastly goes into the low back. Has some stretches. Also has multifidus strengthening. If you have any trouble with your back or you want to prevent low back pain, multifidus strengthening is kind of an up-and-coming thing. A lot of research now coming on the multifidus muscle. Just about any back problem you can name, like if you have a herniated disc or spinal stenosis, if you had back surgery, they go around to sticking the multifidus muscle and imaging it. They find it's actually smaller than normal. It's not conducting like it should. And then if you do strengthening exercise, it gets a lot better and the pain goes away. So a lot of stuff you can work with for the working sonographer that's, keep you out of trouble. But yeah, if you're looking for a good care on critical care ultrasonography, I think this is a good choice. So check it out.